So watch this video if you're recently diagnosed and you're thinking about an MS drug, or maybe if you've been diagnosed for a while and you're on an MS drug, or you're thinking about switching MS drugs, because I'm in that transition phase right now and it is not easy. My name is Cliff and this is Life with MS. Let's go. If you've been following all the drama on my channel, I stopped Kesimpta about 2 months ago. That's ofatumumab. And that was sort of an easy decision because I have had respiratory infection after respiratory infection after respiratory infection while I was on it, and I currently have a respiratory infection. My neurologist thinks I should be able to clear all this gunk up in my head and in my lungs probably by about June or July. I have noticed I have started getting better. I have noticed that the severity of the respiratory infections has been much less since I got off of Kesimpta, but it's still continually there, so that's kind of annoying. Okay, quick disclaimer, I'm a bald guy on YouTube with MS. I am not a healthcare professional, I'm not a physician, I'm none of that stuff. This is just my experience. Please don't follow my lead on this one. Talk to your care provider if you have questions about your specific situation. Since I've been off Kesimpta, my fatigue has greatly lessened. When I'm on the DMTs, and this also includes Ocrevus from the years past, I fatigue really easy. And I'm not going to say the fatigue has gone away completely, because it certainly hasn't, but it has greatly reduced. In fact, in the time that I've been off the drug, I have been able to finish a project for NASA. I have been able to finish a personal training certification through the International Sports Science Association, and also a specialization in helping people with multiple sclerosis with movement and strength. So I just don't think that's stuff I could have done with the rest of the stuff in my system, or it would have taken me a lot longer because I would have had to continually take naps and the cog fog was just crazy. So that kind of shows me that there is some impact from the medications, and when I'm off them, I definitely feel better. However, what are the risks? I would think the risks are pretty high. At this point, I'm a very high-risk patient because I have a lot of damage already in my spine, and I'm just starting to feel better to some degree, or maybe I'm just managing it better. I'm not really sure. So Dr. Boster, without further ado, let's cut to you and see what you have to say about this stopping a DMT at a certain age.
The short and the long of it is, if you have an immune system with MS, it's going to attack your brain and spinal cord. And it's going to risk hurting your nervous system and causing damage. And if you have neurological features that you like seeing or smelling or having an orgasm or moving your hand, I want to do what I can to preserve the neurologic reserve. And I think that it's absolutely nonsensical that just because you celebrated a certain birthday that we should then say, you don't need treated. I do think that as we age, and when I say as we age, I'm talking about people in their mid-60s to mid-70s, it is reasonable to discuss de-escalating to a different agent. But I think stopping is absolutely wrong. I feel very strongly about that.
Okay, so clearly we can see where he stands. And this guy is highly, highly experienced, and he knows a lot. And so I have to take what he's thinking into account. Now, my own neurologist seems to think he may want to put me on a new DMT, but there is a possibility I may be able to discontinue. I don't know. We're still working through that. But there are other neurologists that are like, yeah, and once you hit age 50 or 55, you can completely come off this stuff. We don't know the actual long-term effects of that yet because really that hasn't happened. I know there are some class of drugs out there for MS that can put you in a nasty relapse if you instantly discontinue them, but I don't think that's true of something like Kesimpta and Ocrevus, but I'm not sure. Talk to your neurologist about that if you're actually interested in learning more. So what are the next steps? Well, I'm going to find out in June or July. Until then, I'm going to keep plugging away. I think this is one of those things that's going to affect everybody that's going through that aging process. If, I'm 48, I'm getting up in that area where it's like, according to some people, it's questionable whether I stay on the drugs or not. And a lot of you have voiced your opinion before on another episode I did about me quitting my Kesimpta. I keep going back and forth. I apologize for that, but this is confusing as can be. Only the future is really going to be able to tell. And I got to tell you, if I continue to feel the way I do when it comes to June or July and I have to make that decision, that is going to be brutally difficult because I feel really productive right now. Could it be the cooler weather? Could it be the alignment of the stars and the planets? Who knows? This is MS, right? It can be anything. But I did notice when I went off Ocrevus for about a year, I actually got a lot of my energy back. And I did notice the second I went on a DMT, things started to slump again. So I'm going to keep you apprised. And if you visit Boster's channel, please click that sub. I guarantee he will give you information weekly that you can use with your MS. If it's not just life management with MS, if it's not drug management, I mean, he covers really the spectrum. He also runs the Boster Center for Multiple Sclerosis, which I think probably has a really good story within itself. I'm trying to set him up for an interview on this channel so we can hear from him. Anyway, my name is Cliff. Thank you so much for watching. Click that like and share if you found this valuable, and also subscribe if you haven't already, because you know I like to stay in touch with you. This is Life with MS, and for today, I'm out.